and welcome to the Train Right podcast. Today's guest, we have Dr. Teddy Bross. Dr. Teddy Bross is a third-year family medicine resident with training focused on sports, wilderness, and integrative medicine. He is a licensed physician in Colorado and holds certifications for advanced wilderness life support, CrossFit, and American Institute for Avalanche Research and Education. Teddy competes in endurance events from the marathon to the 100-mile distance. He has 10 100-mile finishes, including races such as Leadville 100 and Western States 100, as well as running 107.7 miles on the treadmill in 24 hours. Ouch. Teddy currently resides in Boulder, Colorado, where he cooks vegetarian food, practices medicine, and enjoys the camaraderie of the local trail running community. Hi, Teddy. Thanks for being here today.
Thanks for having me on, Hillary. Huge honor, and really excited to be here.
Yeah. So, thanks for enduring the, listening to your bio as we do this. So many things I want to talk to you about, but we have a fellow love of science. I can talk to you all things science, like talk your ear off. But we kind of discussed a lot of topics we want to talk about, but today we want to focus on sleep. So I always think it's really interesting, especially in ultras, kind of this management of sleep. Like there's a ton of races that not only they start at like 6 p.m. Like I want to do UTMB one day and it starts at 6 p.m. And it's like, okay, well, how do I approach that from a training perspective? Like in my, from a race day perspective, but also like in my day-to-day, training life. And so we'll get into this a little bit later. You've had some incredible experiences with like sleep deprivation and like during your own ultra endurance events. But yeah, like, so basically sleep. Can you why is it so important? Why do we care about it? Obviously specifically in day-to-day life, but also in running.
Yeah. Excellent questions. And I think just starting off, deciding kind of why sleep is important is a huge deal, and something that we're kind of seeing to, finally turn the corner, especially among athletes, particularly like professional and elite athletes, placing more of an emphasis on sleep. I think that the rest of the population is probably still catching up to that. Around like 2/3 of adult Americans don't get the standard 8 hours of sleep a day. And what we know is that athletes need even more sleep than that. So,
we do.
Recommended for like elite and professional athletes is around 9 hours of sleep. That's recommended by like the NCAA, the Olympic Federation, and for the most part of like why do we sleep? I think that people tend to in research we always want to find like one specific cause or one specific reason why we do something. And I think that when we spend about a third of our life actually doing, it's not going to have just only one reason why we sleep. And coming from that perspective, there's so many reasons why you should sleep. And we can break it down into kind of acute reasons, being like if you get one night of bad sleep versus one night of good sleep. And chronic reasons. So over the long term, when you're chronically sleep deprived, we're seeing higher rates of cancer, higher rates of Alzheimer's disease, and higher rates of heart attacks. This is 3 of the top 10 major causes of death, in the world. We also know that just on an acute level, if you get a single night of sleep deprivation, your body doesn't regulate sugar as well. Your perceived exertion is much higher. Your ability to tolerate pain is actually much lower. So these are all like small little reasons why sleep is important. But really just, kind of on the broad scheme, when we get good sleep, we are optimizing our bodies from a mental performance standpoint as well as from a physical performance standpoint.
Man, see, this is like, I mean, I knew this just because of, how much I exercise and how much I think sleep plays a role just in my personal life. Like, I feel like I'm always thinking about it from a scientific perspective. Like, I'm my own science experiment. And so, like, I know if I don't get a very restful night of sleep and I have a workout the next day, like, honestly, sometimes I'm just like, well, I'm going to push this back because I know I'm not really going to get that much out of it. Or, if I go out on a run, I can feel, you say, like, that's really interesting about your ability to regulate pain, because I mean, let's be real, like in an interval, like its ability to withstand pain and like that uncomfortable feeling and push through it. So if you're unable to regulate that, you just kind of feel like crap. And then as far as I feel like I have sometimes a higher heart rate, right? Like I just feel like I'm not quite as recovered. And so, I mean, I'm a coach, and so I say that to my athletes all the time. It's like, if you don't get a good enough sleep, push the things back. Like I would prioritize getting good sleep rather than, that run at 5 a.m. before you have a flight that day or something like this. Like, and I mean, as far as with athletes, like, why do we need more? Like you said, 9+ hours.
9+, yeah. I
Dang.
think it's like 9 hours and 15 minutes is the current recommendation.
Oh my gosh! See, I
and
get like 8, which I mean, I like.
That's really good. That's more than most.
But I mean, I definitely prioritize that. Like, for instance, like this morning we went for a run today before we were doing our podcast, and like I like to get up early and like do some things and kind of like wake up before I go running. But I mean, if I'm going to do that, we were running today at 6:30, then I'm up at 5 or 5:30, and so that means I go to bed at like 9. Yeah, I mean, I always joke that I'm a grandma, but hey, it's like it's what I do.
I think that's really great though, and you're prioritizing it,
Yeah.
And I think that from the athlete standpoint, that's something that, like I said, we are seeing a little bit more of. We're seeing athletes prioritize sleep a little bit more. But why should athletes do that? Why should athletes kind of prioritize sleep a little bit more? I think that we're getting more information on that. There's a study done that looked at the correlation between athletes who sustained bouts of depression and how much sleep they were getting. And the optimal was at least 7.5. We're recommending you get 9. And what we know is that there was a study done where athletes increased their sleep by 30-minute intervals up to the maximum of about 10 hours per night. And performance continued to improve across that entire spectrum. So if you can improve or increase the duration of sleep by even as little as 30 minutes, you're probably giving yourself a little bit of a performance advantage. With sports, we're seeing, races won within a matter of, seconds or depending on the distance, less than a second, and tenths of seconds. And so those small little performance advantages can be what make or break a race for you.
Yeah.
Like just on the acute, kind of looking at it again, like acute versus more long-term or chronic. When we look at it, the acute, short, 1 night of sleep deprivation, when you get 1 night, it does have effects on you. But your body is able to compensate a little bit for that. What we know is that you as a coach recommending that your athletes, if you're not getting good sleep preemptively, do not do a hard workout that day is really good, because actually our brains are not fantastic at letting us know that our performance is worse. And so if we're not using objective measures, things like looking at our heart rate or looking at our split times, if we're not doing that on a consistent basis during that workout, we won't even realize that we're running slower or that our heart rate's higher. We'll just feel worse and think that we're just actually performing faster or running harder. So your brain doesn't really look at it and say, oh, I'm breathing heavier here because I'm a little bit sleep deprived and I'm having to work harder. Your brain actually twists that a little bit and says, well, you're actually running faster than you think that you are. And so you it's a little bit of a twist, and your brain does this kind of weird game with you. Now in the long term, if you're chronically sleep deprived, from an athlete's perspective, overnight is when we produce something that's called growth hormone. Growth hormone is produced within the first 90 minutes to about 2 hours of sleep onset. And that release is really, it's really due to the onset of melatonin. So it's really timed based off of your normal circadian rhythm. So if there's a night when you stay up late, you're out with friends or something like that, usually you're imbibing beverages that are also not going to be great for your performance the next day. Those short sleep deprivation periods, they tend to also come with that you prevent that release of growth hormone. You miss out on a lot of that period when growth hormone is released. And if that becomes something that's chronic, growth hormone is something that it works on fat metabolism. It works on building muscle, protein utilization and optimization. And so that's something that's really important for athletes. And so you want to get as much of that as you possibly can. That's really why having a consistent bedtime is really important for athletes. And we normally say having a consistent wake time is important as well. And that's also mainly because your body kind of times your circadian rhythm based off of your wake time every day. And if you can make that routine, that's when you get the best quality sleep.
Yeah.
That's when your body's hormones are going to be kind of most optimal and consistent.
Yeah.
And also from a mental perspective, when we see people chronically sleep deprived, your cognitive functioning just isn't kind of optimized. And so what we were talking about before with, having a higher perceived effort, having a lower threshold for pain, over the long term, you're just not going to be accumulating the same kind of gains in your training and your workouts that you probably could be.
Yeah. I mean, this is all really good information. I've heard about this is like, kind of sleep hygiene, like having a routine. And I mean, I love that. Like having a kind of a bedtime routine to kind of relax you if you have trouble, like calming down, like my mind's always going. Whether that's like, for me, it's like tea. But again, it's like, even this is sometimes like a night if I stay up super late, like with friends or, because life is all about balance. It's like, I can't, always be in bed at the same time every single night, especially like on a Friday night. But I do notice that even if I go to bed later, I still wake up at the same time. So it's like, I try to be like, okay, like stay in bed a little bit longer. And like on those days where I know if I'm going to bed later, I try to still like get the same amount of sleep. But I mean, it's part of that kind of, like you said, that teaching your body that routine, that it definitely learns it. I mean, but so, I mean, I want to shift to, because you mentioned a lot of good things about races. And I always get this question when there's athletes that I'm coaching for a certain event where they start running through the night. So they, like, for instance, UTMB, like a ton of European races, like Lavaredo, all of them, they start, like, Lavaredo starts at 11 p.m. and UTMB starts at 6 p.m. on a Friday. So you start the night. I mean, even like races in the United States, like Run Rabbit Run, you start at like noon. So you're still running into the night, like pretty soon into the race. And, if you think about it, it's like, if you're finishing in 24 hours, or like, even if you're not for a race like UTMB, like you're usually missing 2 nights of sleep. And so the athletes ask me, they're like, okay, so how do I prepare for this? And they're like, do I need to run overnight? And honestly, my opinion, and this might not be correct, this is obviously like, this is my opinion from my, like, my quote unquote athletes that I've experimented on or myself. I'm sorry guys for I coach. It's out of like the like love and I care about you. I'm not trying to like, ruin your performances, but I honestly argue that it's better. Like, here's what I ask them to practice. Like, practice running into sunset. Like, start the run at maybe 8 p.m. end at like 11. Like, run when the sun is going down. But I hardly ever recommend any athlete to run like consistently through the night, because I think that the benefits of that, maybe, I mean, it is certainly psychological, like the confidence, be like, oh, sweet, I did that. I can run through the night. I can do it. But I think that is definitely a benefit. But the physical kind of negatives that it brings, I think far outweigh any sort of psychological benefit that you can gain from it. And on race day, like, you're going to have enough adrenaline that I think you can figure it out. At least I hope. But that's generally been my philosophy. But I mean, you have experience with this kind of like with the sleep deprivation in your, pursuits from 100-mile races. And I mean, we can get into like what you did this summer with Nolan's, but also, I mean, chronically, like, how do you manage sleep deprivation because you're a doctor, you work insane hours. Like, you know, basically we've had to wait however many weeks to be able to have some time to actually record this because, you know, you're either running at 5 a.m. or like, you know, inpatient at 6:45 in the morning. Like you have to prioritize sleep, but like you might be in a chronically like sleep deprived. I don't know. How do you manage that with work and training? Because especially for an ultra.
Mm-hmm.
Yeah.
Yeah. All good questions.
There's a lot right there.
And so I would say, so first thing is looking at kind of my own experience. Certainly have had plenty of experience with sleep deprivation. You know, for medicine, we do 24-hour shifts, which usually turn into like 30-hour shifts, just because of kind of crossover, cross-covering and you know, transferring patients over to the new team coming on.
Yeah.
And that, what I've kind of learned in that experience is number one, that you don't get any better at it the more you do it. And so I can do as many 24-hour shifts as I want to.
You're still gonna be tired.
But I'm still gonna be tired. The period.
Dang it.
Yeah, exactly. The period between like, you know, about 1 a.m. to 3 a.m. It never gets any easier. You always feel tired during that time.
Wait, what is the period? 1 a.m. to
like 1 a.m. to 3 a.m. I just,
yeah.
That's always a really, really weird time to be awake, like the witching hour, right?
Yeah, it's like for alpine starts. Remember, like a 3 a.m. wake up call versus or a 2 a.m. 3 a.m. versus like a 4 a.m. 2 a.m. feels like, and 3 feels so bad.
Yeah,
but 4 a.m. feels kind of okay.
Like 5 a.m. feels a little more civil, right? But if like when you're asked to wake up at 3 o'clock in the morning, even it's brutal.
Yeah.
So that's kind of one. Is one, you don't get any better at it. So I don't know if practicing it, if you really have a whole lot of benefit. Number two is that even when I am sleep deprived at 3 o'clock in the morning on 24-hour shift, I know based off of what I have read that my cognitive functioning is it's low. It's inhibited.
This is such like a I love it. Based on what I've read, my cognitive function is low. It's like you're sciencing it. I get it. No, I would do the same thing.
Yeah, but like while I'm in that moment, like I kind of said, your brain is pretty good at hiding that from you.
Yeah.
And so you think that you're still capable and functioning fairly well. And so during those times when I'm working, I'm utilizing quite a bit of external factors to try and keep myself alert and cognitively aware. We can talk about those things. We can get into things like caffeine and you know, what are good ways for us to actually maintain some alertness when we are sleep deprived.
Yeah.
But that's the other one, is trying to kind of be more aware that I'm not functioning at my best during those times.
Mm-hmm. So like asking for help. I mean,
yeah.
I think maybe a little bit of this too is this whole idea of like, just a quick tangent, like pacers in races. Like it definitely helps.
Oh, absolutely.
But yeah, continue.
We'll get into that more when we kind of talk about Nolan's, I think.
Yeah.
But okay, so number one is that practicing it doesn't help you a whole lot. Number two is that really, even when you are in that moment, you're not realizing how much it's changing your cognitive functioning, and it is impacted significantly. You know, we've done studies and we've even compared the cognitive functioning decrease to somebody who's, say, drank alcohol. And, you know, your level of impairment is actually pretty consistent after 23 hours of sleep deprivation.
Yeah.
As someone who's had about 3 to 4 beers. And
really?
So, yeah.
I would be wasted. I'm such a lightweight. Oh my gosh. I feel it after like a half a beer.
Yeah. And that's going to vary by what your tolerance level is. But, you know, it's the impairment is significant, you know? Yeah. So when we look at it from that perspective, what I usually do for myself is I don't really see a huge benefit in trying to practice sleep deprivation. And what I would actually encourage people to do, so when we're looking at events that do require that are going to require a significant amount of sleep deprivation, or, you know, just have weird start times so that there's really no way around it. I mean, if you start 11 p.m., you're going to be running through the night for, you know, 100K or 100-mile race.
You know, you've usually been up all day too, right?
That's right. And it's hard to change that circadian rhythm to be able to sleep during the day. Whatever sleep that you get is not going to be super restful.
No.
So I would say that from that perspective, when we're leading up to those events, there are some things that you can do. Number one is make sure to optimize your sleep leading up to that event.
Mm.
And so what I would say is, like we were talking about a little bit ago, is that when you have, you know, an acute sleep deprivation, you see decline in functioning. If you were to increase your sleep, for an athlete, say, you're getting about 8 hours of sleep. If you were to increase it by 30 minutes or even an hour, I usually say 30-minute intervals because it helps your body kind of adjust, and you can adjust a little bit better to a 30-minute change as opposed to an hour. But you're going to see an improved performance with 30 minutes of increased sleep. If you do that for a week, you can get up to an hour of increased sleep a night. So you could get up to 9 hours of sleep the week before your event. What we also know is that, and I'm sure most athletes kind of experience this, there are the calm and collected few who are able to sleep peacefully the night before an event.
I can do that.
You can do that.
Usually.
Not all of us are blessed with that amazing capability. And what we see is that usually the night before an event, you're not getting your optimal sleep.
No.
You're not getting high quality sleep. A lot of times people wake up, and they're awake at 3 o'clock in the morning for no apparent reason. The night before their race because they're worried about it, or they're worried about waking up on time. And then they try and go back to sleep. So sleep is usually disrupted the night before an event.
Or just shorter. I mean, at least shorter. Yeah, like I remember TDS. Like I woke up. The race started at 4 a.m. So I was up at 2. So it was like, I slept, but it was not for that much.
yeah. Or there's significant travel that's like associated with it. Some people are like driving to the start of the race that morning of or the night of, and so your sleep is going to be a little bit worse the night before. And so you can. I don't know if there's really. I don't know if there's really literature on like sleep loading or sleep banking.
Yeah, I was about to ask. Yeah.
I haven't seen any study that really shows that, but what we know is that your performance will improve when you increase your sleep leading up to an event.
Yeah.
And so you might as well try and optimize your sleep and increase your sleep a little bit before you have a big effort coming up.
With this, I mean, obviously the idea of sleep banking, but I would say your bodies can adapt pretty fast. So, I mean, the timeline for to have some sort of like the benefits of, like not banking sleep, but having better quality sleep or more sleep leading up to a big event. Would you say like a week, 2 weeks? Like,
yeah, I would say,
depends, but
there's really no, I mean, if Hillary, if I can encourage you to get 9 hours of sleep and you could say, should I do that a week before or 2 weeks before, or should I just do it all the time? I would say you should just do it all the time.
I can try,
but most people are able to prioritize their performance a little bit more leading up to a big race.
Yeah,
so,
for sure.
I would say if you're looking at a window, same thing we usually encourage people to do altitude acclimatization, usually about 2 weeks before an event. So I would encourage people, hey, if you're gonna place a higher priority on it, and that's restricted by your normal everyday, so you can't just do it all the time. Try and do it for 2 weeks before.
Yeah. Okay, I like that. I know maybe I'll work on the 30 minutes at a time.
Yeah, and the other side of this too is the reason why I would say it probably has some benefit in a short term. Is that there are some studies which, when we look at something that's called like social jet lag. So when we were talking about like, on the weekend I stay up a little bit later, but then you might sleep longer. You say that you wake up at the same time every day, which science would agree with you. That's the best thing that you should do. And you should probably take a little bit of a nap at some point early morning throughout that day. But the rest of society is not as responsible. And a lot of people, they're getting 6 hours, 7 hours of sleep throughout the week. And then on the weekends, they're sleeping until like, 12 o'clock, 1 o'clock to try and catch up, in quotes, on sleep. But what we have seen is that there is a little bit of benefit to that.
Okay.
But you're better off having consistent times in your sleep. So even though you are getting a little bit of benefit from that increased sleep on the weekend, you would get more benefit from having a consistent sleep structure, and in the long term, that's going to be more beneficial for you.
So does that mean, like, even if you stay up later, still waking up at the same time, but then like complementing that with maybe a nap instead of like, like sleeping till noon, which I could never do.
Like, that's exactly what I would recommend. Yeah. Okay. And I would, you know, if we're going to talk about napping, you know, that's another one of these. So in events, especially ones that last several days or you know, more than like 24 hours, we see significant changes in your cognitive performance when we start getting into like the 36-hour period of sleep deprivation. And so there are people who may at that point want to sleep during an event. And those, you know, nobody's getting 6 hours of sleep during an event. No. But you might get, you know, what I have seen is that a 10-minute nap is usually optimal. That's going to get you a slight amount of light sleep that will affect your alertness and your cognitive function and improve that. And if you sleep longer, say a 20-minute duration or even a 30-minute duration, the downside of that is that your body starts to get into a deep sleep. And we can get into sleep architecture if you want to, but deep sleep it's more restful sleep, but it also is tougher to wake up from. And so we get something that's called sleep inertia is usually the term that's associated with that. And so the benefits start to get a little bit outweighed by the downsides when you get into that 30-minute range. So usually optimal for people is somewhere between a 10 to 20-minute nap. That's going to give you a little bit of the cognitive bump that you might need. Now, what we know is that you need deep sleep in order to get that muscular or connective tissue kind of recovery, as well as some of the deeper brain functions, things like memory. You need some deep sleep in order to see transfer of long memories or like a short-term memory into long-term memory. You need REM sleep in order to get some emotional processing. And so when we look at sleep architecture, if you want to get any of that, especially if you want REM sleep, then you're looking at more of like a 90-minute cycle. And I would encourage anyone who is looking at doing an event where that's going to be multiple days, you probably want to know how long a sleep cycle is for you. And a full sleep cycle is lasting from light sleep, going down into deep sleep, and then getting some REM sleep. And REM sleep is actually a lighter form of sleep. It's actually when your brain is most active. Deep sleep is when your brain is least active. And that's probably why we see most of the benefits of recovery for the body during deep sleep. And while REM sleep, we see most of the recovery for like emotional processing or dreaming occurs most often during REM sleep. And there's fascinating studies that have been done on REM sleep associated with emotional processing of like trauma or you know, cognitive dissonance when something happens that it's very tough for you to wrap your head around even. And so that emotional processing can certainly take its toll, especially if people are cutting their sleep short. And so if you're not getting that full 90-minute sleep cycle, or even just over the long term, if you're cutting your sleep short, so getting 6 hours instead of 9 hours, our bodies tend to get more REM sleep later in the night of sleep than earlier, when our bodies tend to focus more on deep sleep. So body recovery early in the night and emotional recovery kind of later in the night.
So I see, Teddy. So it's like basically if I want to have more success in my relationships, I should sleep longer. Just kidding. That's really bad. But...
Well, actually, there's been some cool studies on that. And you can actually see some benefits of REM sleep. Now, I'm not saying that you, Hillary, don't do well in relationships, because I think that you're a great friend and you have no problems on that point.
But maybe we'll see. Jury's out. Anyways, no, but okay, so this is all fascinating. But I think this is gonna be like, we should go into Nolan's because
sure.
Okay, so because all these sleep strategies, like quickly, I'll kind of when I'm preparing athletes for kind of multi-day, I just had this athlete who did an FKT, so fastest known time, on the Wind River High Route. Now he didn't. It was like 3-ish days. So he did little naps, but not really like any significant amount of sleep, because he was able to, I think it was short, quote unquote, short enough. But still, I mean, there's a whole bunch of different strategies, and at CTS, as coaches, we always throw around different papers and kind of ideas about like what works best. Like for some of these longer events, I mean, I'm sure everyone was watching Courtney DeWalter this past summer, where she was trying to attempt the Colorado Trail.
Gosh, she's amazing.
Oh my gosh, I know. And she really, like, she's really well practiced, I would say, even though you can't supposedly get good at being tired. Maybe I think she's pretty good at it, but she didn't really sleep much early on. And then she kind of took the approach of taking a little bit maybe longer, maybe 30-minute intervals. But again, I think for most people that I coach for these longer multi-day events, I would recommend kind of the short little stints, like the like 10 to 20-minute range. But again, it's knowing your body and kind of what works a little bit best for you. If you can kind of wake up from that like groggy deep sleep and you're okay with it, if that makes you also feel like psychologically better, then for sure I tell my athletes to go for it. But so I would say that you're a little bit well practiced at like sleep deprivation, just because of the nature of your job and all the things you have to balance. But so you had a cool project. I mean, for anyone who doesn't know what Nolan's is, I mean, we're here in Colorado. I mean, it's been a route that I've known of since I started ultra running. But Teddy, I'll let you take it away. What is Nolan's? And yeah.
So Nolan's route, Nolan's 14. It's essentially 14ers in the Sawatch mountain range. So there's actually 15 peaks in the Sawatch, and the route doesn't incorporate Mount of the Holy Cross. It's about 30 miles north of Mount Massive, which is the northernmost on the route. Yeah. And so there are people who do Holy Nolans, and they add on a little bit extra on top of the whole thing.
Because if that wasn't badass enough,
yeah.
And let's be real. So 30 miles extra on a 100-mile mountain route off trail.
Yeah. So it's about depending on the route that you take, somewhere between about 92 is the lowest mileage that I've seen, to about 106 miles of as far as the distance goes. And you're getting somewhere around 45,000 feet of vertical gain over the course of that route as well.
No big deal.
Like you said, this is a lot of it is off trail. You are on trails for some of it, and it's just based off of the nature of the route that you choose. So really the only rules are that you start at either Fish Hatchery or Blank Cabin, and you tag all 14 peaks, and you make your way to the opposite point.
And Fish Hatchery, like it's outside of Leadville, but
it is. So it's outside of Leadville. It starts just a little bit north of Mount Massive. So there's two different routes. You could go southbound, starting at Fish Hatchery, making your way up Mount Massive and going all the way down south to Blank Cabin. Or you could go northbound, starting at Blank Cabin, which is down outside of Salida. And you head up towards Shivano for your first peak, and then you make your way out to Fish Hatchery from there. And so the routes can differ among people. So there's slight variations. Enough people have done it really at this point that there's a fairly well-defined route, although
especially after this summer. I mean, I feel like
there's a lot of people on it this summer. There's a lot of people, and so it is fairly well defined as far as kind of where to go. There's enough data out there now with GPS devices that you can kind of piece it together. Depending on your capabilities on the route, you can have satellite and see where you're at. Can, people will put the route on their watch even, and that can help with navigation. But in order to do it well, I think you have to spend quite a bit of time out there. And so that's getting to know the area, the places that are off trail, getting to know the good connections between trails when there are some, and getting to know when, what's going to be beneficial. There are times when, even if there is a trail there, it takes you, in different directions, and it may be a little bit more of a circuitous route. Where there may be a better way to go directly up the mountain. And so that depends on what the terrain is like. It depends on, if you're going downhill, there might be a really great scree field that you can just boot ski down. Instead of taking a trail that, will zigzag and switchback. because we're here in America instead of like France where you're
I was about
training.
to say, yeah, France, we don't like switchbacks. Just go straight up the thing and straight down.
So I think that you can get better at it the more time you spend on it.
But so this is, I mean, I love this route. It's super cool. I mean, like you said, there's maybe more of a designated like trail after all the people that were, out there this summer. Shout out to Megan Hicks and Sabrina Stanley for doing the epic battle of, the FKTs on that route. But going back to this idea of sleep and, the more sleep deprived you are, the less cognitive function you have. So this is a route that you have you have to scout it. You have to know kind of these areas, and so this requires like obviously long-term memory. So in a training cycle, when you're training, you have that good sleep. You have the opportunity to kind of put it into long-term memory. But then when you're out on the course and you're doing this route, and you encounter Nolan's, to complete it successfully, it's a 60-hour time stamp. Like, so you have to finish it within 60 hours to have it like, stamped officially in Nolan's. Like,
that's right.
And so, I mean, that's nearly 3 days, of sleep deprivation. And not only, I mean, we didn't talk about this, we don't have to, but I think there is a factor to consider that you are at altitude. So sometimes, I mean, I think the effects of, physical stress can present themselves a bit sooner, or in maybe more extreme cases when you're at altitude. Because, in the valleys, you're still at like 10,000, 9,000 feet. I mean, Leadville is at 10,000 feet outside of Fish Hatchery. So, I mean, I want to bring it back to kind of this, and you can tell us something that happened during Nolan's for you. But this whole idea of what does it mean? Like, what was your strategy going into Nolan's from a sleep point of view? I mean, I was quite impressed to hear some of your strategies of this, and did you notice anything when like cognitively for like route recognition and like maneuvering when you were out there?
Yeah, I love all those questions, and we'll do a little bit of a dive here. So, the reason why this is so applicable to our topic of sleep today is exactly what you said. So it typically takes people, I think the fastest known time on the whole route going either direction was set this summer, and was a mind boggling. I don't know how Campanelli did that, but even his record, I think it was 49 hours.
Oh my gosh.
Was just incredible. And we're seeing most people finish around like in the 50s. So somewhere, 51 to like 56 hours. When people finish, they're typically around there.
2.5 days,
yeah.
It's still really stout.
And so you're going to be running for 2 days without sleep. And so deciding what your how much sleep you're going to get, are you going to sleep? Those were big kind of questions going into it for me. And I knew that, I was going to try to get some sleep on the route, mainly because you just start to deteriorate in your cognitive functioning so much so after 2 nights without sleep at all, that if I wanted to have any kind of success on the route, figured I was going to have to get some. I do wear a smartwatch at nighttime when I sleep, mainly to try and figure out what my sleep cycle is.
That was a question I was going to ask earlier.
Yep. So most of smartwatches are have the capability to do what's called actinography, or kind of measuring your sleep architecture while you sleep. And so they're not fantastic at describing whether or not like what stage of sleep you are in, other than really telling you when you're in deep sleep, when you're in light sleep. Some of them are pretty good at showing whether or not you're in REM sleep. And so you can get a fairly good idea even just with something like a Fitbit or an Apple Watch, or most like the Garmin watches, or I don't know if like the Kuros or Suunto watches, if those have an actinographer in them. And so you can go back and analyze what is a sleep cycle for you. And so I did mine, and mine's about 90 minutes, a little less than 90 minutes. And so I knew that if I wanted to get a full sleep cycle, I would have to sleep at least that long. I also know that looking at my sleep architecture when after I do like a 24-hour shift, that I fall into deep sleep much faster than typically. So normally it takes like 20 to 30 minutes for you to actually get into a deep sleep stage. Whereas when I'm sleep deprived, and this studies back this up, that when you are sleep deprived, your body will fall into deep sleep much faster. So it can take even just a couple of minutes, somewhere between, like 5 to 15 minutes for you to fall into deep sleep. Um, and so your body will fall into that deep sleep stage much quicker. It basically, your brain is saying, we need this, and so it just triages out the early stages of sleep. And so I kind of knew that going in, and so I really tiered my approach around those two things. Was I knew I was going to take short naps, about 10 minutes in length, and I knew that I was going to try and get at least one sleep cycle in at some point. So I was going to try and aim for only doing one 90-minute bout of sleep, and then trying to substitute that or supplement that with a couple other small 10-minute naps. And funny enough, I started actually around 6 p.m. at nighttime, mainly because of the points where I was going to be on the route at certain times of day. So because this is not a race, there's no aid station set up. And I had my dad, my buddy Chad, my buddy Teddy Lyman came out for a little while, and then my other friend Roger came out for a little while. But the mainstays were my dad and my friend Chad, who flew in from the great state of Ohio. And those two, they were my main source of getting any kind of aid. And so they were driving in, up, back, country roads, up these mountain valleys. And so it depended on when they could get there, if they were going to have to hike in, and we had to really decide whether or not they were going to be able to get to a spot where I was going to be at specific times. So that really changed when I left. In retrospect, not a great idea, because I ended up having to run for 3 nights in only 2 days. I also started in September, the end of September, which at that point the sun was setting around 7 p.m. It wasn't rising until like 7:15. And so I was getting much less daylight than if I would have done it in the summertime. All those things being said, what I ended up doing was going through the whole first night, running without sleep, and then getting about a 10-minute nap before, kind of like right as the sun was coming up. And then continuing along. The second night got super weird. At that point, I'd only had 10 minutes of sleep.
No big deal.
I started having hallucinations. I was seeing rock cairns, which if anyone doesn't know what those are, it's basically small stacks of rocks to demarcate where
the trail
a trail is.
Yeah.
And I was seeing these in a boulder field between Harvard and Columbia. And when I would get up to where the rock cairn was, it was gone. It would just disappear. So it was like a mirage. When people are out in the desert and they see an oasis. For me, my oasis was a rock cairn, and it would just disappear. If you look at my Strava, I like zigzag back and forth. I like go through multiple circuitous routes.
You're looking for security. You're looking for this is the route.
It was bad. It was bad. And my headlamp died up at the top. And so that second night, I was already seeing cognitive decline. I was already seeing my alertness was obviously decreased. My ability to even just make decisions, it took much longer to make decisions. And I still had a whole other day and night to go through running. And my experience actually ended at peak 12. So I was up on Antero, and it was dark already for me. And I was having small little micro sleeps. So basically I would be running, and I would wake up in a new location, essentially, that I didn't remember how I got there. Basically like small little amnesia episodes almost. And I think it was my body just prioritizing sleep. It's like if you were driving a car, people will have micro sleeps where they doze a little bit, and that was happening to me while I was running. I was also like having like difficulty again, like making decisions. I wasn't alert. So I actually made the decision at that time to turn around, and I went back down Antero, which is a Jeep road up until like 13,800 feet.
Yeah.
It felt safe and secure to me, and I didn't feel comfortable going up kind of the Boulder Ridge to get up to Tabawash, which was 13 and 14.
Yeah.
So I was probably about 5 miles away from completing the whole thing.
Dang. But no, I
But
mean, yeah, I think that's smart, because I mean, you can actually, like you said, it's like a safety
That's
kind
right.
of standpoint from that point. I mean, for my athletes, I always recommend, it's like, you can run through a certain amount of discomfort, but it's like your responsibility to know if that's actually going to cause more pain, like long term, like a risk of serious injury, versus like, are you just having a pity party? But I think that's a really important distinction to have. And like you come into that line when you're doing these multi-day events, especially dealing with something as important as cognitive function on a route, that you have to be aware and like make decisions. Like, you're at altitude, you're in, people can die of exposure. I mean, storms can move in very quickly. I mean, maybe people are like rolling their eyes at this, like listening to it, but I really do think so. I mean, I've had a mountain accident and an injury, and like I see how quickly things can change in the blink of an eye, and you really have to be aware. And so being able to kind of make that distinction and being like, okay, well, I'm putting myself in a dangerous position, because like, even if you like physically feel okay, which you did, cognitively, like being able to kind of maneuver down this boulder field and safely up to like these next peaks, you can put yourself in serious risk if you're not kind of all there.
Yeah, I totally agree with that. And I think that when we're talking about multi-day events, that's probably something that people underestimate the most.
Yeah.
When we look at the event Big's Backyard Ultra,
Yeah.
and that's, if anyone is unfamiliar with this concept, you should look it up. It will blow your mind. But essentially, there is no finish to the race.
Courtney Dauwalter is a badass.
Yeah, Courtney Dauwalter just won this year the American Big's Backyard Ultra. And it's a last man standing race. And so essentially, runners compete in a 4-mile loop. Once an hour, you go out. Everyone has to start on the hour. And you just run loops until there's only one person left. And in that event this year, you see sleep deprivation just at its its pinnacle. I mean, we're seeing these athletes running. I mean, they ran I think this year they'd made it into the 60s. It was
I think their goal was, what was Courtney's goal? Like, what did they get?
300 miles, which would have been 72 hours.
Yeah.
I think they made it 67.
60 something, but yeah.
Yeah. So, and it was down to 2 athletes at that time. And, Harvey Lewis is somebody who I've run with and know from being from Cincinnati, Ohio.
Ohio.
He's an exceptional human being, but in addition to that, also really an amazing athlete.
Yeah.
And somebody who's not as well known really in the ultra community, even though he's won events like Badwater. He's run in 100-mile races like Burning River 100.
Yeah.
But he pulled out of that race because of sleep deprivation. He just couldn't sustain that. And what we're seeing is that the mind will give up before the body does. You can train your body as much as you want to, but if you're incapable, that's going to be what stops your progress.
Yeah. Oh man. So I'm going to see how many questions I have left for you, but I guess one quick follow-up question for Nolan's, and then we can kind of end with your, like, if people could take away one piece of advice from this podcast, which there should be many, so I hope everyone's taking notes. But the one thing for Nolan, so you're going to attempt it again this next year. Would you, so regardless of, the time of year that you're changing it, all of these things, would you change anything from a sleep management point of view, or how you would, that strategy? Like,
yes, I would. And I also supplemented with small, like 10-minute naps while I was just running at certain points, because I just felt so exhausted. I would just sit down and put my head on my pack and set an alarm for 10 minutes. And then I would just wake up. And even those short little bouts while I was running were great. So I wouldn't change that. I would actually still incorporate those. What I would probably change is I would try to have a little bit more scheduled sleep periods, and I
Mm.
would try to have them at different times. So this time, I ended up sleeping quite frequently, like as the sun was coming up.
Mm.
And that's usually when cortisol is spiking in your body. So you actually
Oh.
get a very big cortisol boost that makes you more alert. It makes you feel a little bit more empowered and energized. Um, and that cortisol starts to rise for most people around like 4 a.m. and then peaks around like 9 a.m. And so I would try to correlate my sleep periods more so with when cortisol was at its lowest point, which is somewhere between like 11 p.m. and 4 a.m. So I would try and get more of my sleep during that time.
Hmm.
Number one, I wasn't physically as productive at that time anyway.
Yeah.
Um, Number two, I think that I would get better rest and my body would feel a little bit more, I would fall into that sleep a little bit easier.
Mm. Mhm.
Um, and so that's number one thing that I would change. Number two is, um, this time I started at nighttime, and so I ended up running through 3 nights. I'm certainly going to change when I start. This time I'm going to start in the morning, and
Yeah.
we'll just deal with where I'm at along the course as it comes.
Yeah.
Um, but I think that will make a significant difference just for when I get that a little bit longer period of sleep,
Yeah.
um, because I want to do it on that second night.
Yeah.
And this time I wasn't sure when to do it because I knew I had 3 nights to go through.
Mhm.
And I wanted to make sure that I didn't get it too early so that
Mm.
I didn't have to take multiple.
Yeah.
Because you're always weighing, how much time are you taking away from actually moving versus how beneficial is this going to be?
Yeah.
Now, I do think at some point you just become so cognitively dysfunctional that your progress is significantly inhibited by sleeping, and you're better off sleeping for an hour or getting 90 minutes of sleep with a full sleep cycle than trying to push through and actually just continue on with those 10-minute naps.
Yeah.
I don't know. I may try to incorporate at least one of those 90-minute cycles. Um,
Mm.
but it depends on kind of maybe how I'm feeling if I try to do two of them.
Yeah. See, and then there's so many factors to consider when you're doing like multi-day stuff.
Oh yeah,
It's so
that's what makes
cool.
them fun, though. I think.
Yeah,
Yeah.
yeah. I mean, even people, who and this doesn't, yeah, like this is 100 miles, right? Like,
Hmm.
so this can happen, not even like in a 100-mile plus event. It can happen in, a pretty mountainous 100-mile, 100K event too. I've
Yeah,
had athletes who do
and
that
we're
too.
seeing the popularity of 200-mile
Oh
races
boy.
like just growing significantly. I
Yeah,
mean, and those are races where this becomes a true factor.
yeah.
Of what is your sleep. What is your kind of how are you going to approach this?
Yeah.
So I think that. This is something that we'll start to see pop up more and more for people. Is
Mm.
how you're going to manage this situation. You as a coach, you're going to have to
Mm-hmm.
go through this more and more of
Yeah.
athletes asking you what to do.
Yeah.
And I think that bringing this kind of full circle back around to should we try to practice this? And I would
Mm.
say I don't think that it's super worthwhile. If you are going to do it, trying to maybe run earlier in the morning when it's dark out to just get experience when it's dark.
Yeah.
That might be helpful. But I wouldn't ever recommend people do it consistently because what you're going to end up doing
Yeah.
is what we talked about earlier is just inhibiting your performance, inhibiting your workouts,
Yeah.
and so making it so that you're just not getting the adaptations that you normally do. We're seeing a lot of athletes get something that's called chronic fatigue syndrome.
Yeah.
Overtraining syndrome is another name for it, where people are simply, they just don't feel motivated. They get exhausted. And people are attributing that more so to lack of recovery than we are to the stress side of things.
Mm-hmm.
So people can stress their bodies out quite a bit. And if you recover well enough and you dedicate enough time to that, people don't tend to burn out. But when you overdo it and underdo your recovery, that's usually when we see that kind of happen for people.
Yeah. Well, so this is then the last question that I want to ask you. So it's like the $1,000,000 question. Just kidding. There's been a ton of like good information in this podcast. So thanks for this. But what's your biggest piece of advice that you can give to athletes when it comes to sleep? It's kind of an open-ended one. There you go. But yeah, what's just your like takeaway message? Like, what do you think that most athletes can benefit when it comes to sleep?
I think it's fairly simple. I would say sleep as much as you can. Aim for 9 hours. Um, if you aren't getting 9 hours, and you have an occupation, or your daily schedule throughout the week doesn't allow the 9 hours, then I would say do everything that you can to try and increase it by about 30 minutes. And have good hygiene practices around your sleep. Be fairly specific about what you do in order to recover with sleep. Um, so have a good practice around winding down at nighttime. A couple of just key points that I probably would encourage people to do as far as just getting better sleep. Um, Number one, we said get a consistent wake time, and try and stay consistent even over the weekend period. If you're not getting an optimal amount of sleep, you can supplement with a nap, but get that nap early in the morning, and try not to allow that nap to go any longer than, I would say, max is probably about an hour to 90 minutes, because then it starts to inhibit your nighttime sleep period. Additionally to that, you can optimize your circadian rhythm by really trying to get some good morning light. So going outside in the morning with the sunrise. We're talking to a bunch of athletes right now, so a good way to do that might be to try and exercise in the morning. When we exercise late at nighttime, exercise tends to increase our body temperature. And we know that you need to decrease your body temperature by about 2 to 3 degrees in order to actually fall asleep. That's why most people find it easier to fall asleep in a cold room, like a little bit cooler at nighttime, than a room that's very warm. So trying to exercise earlier in the day, give yourself about 3 to 4 hours before you are going to go to bed at least, to try and prevent that increased body temperature there. Another thing is we didn't get into a whole lot with like caffeine and alcohol.
Oh yeah.
But those are two substances that people tend to indulge in and are quite accepted in our social society. However, they're both not great for sleep. When people take a lot of caffeine, they're tending to do that in order to compensate for sleep deprivation, and that in turn, caffeine actually decreases our body's ability to fall into a deep sleep. And so even people who say, "Oh, I can drink a cup of coffee and go directly to bed," they're still getting less deep sleep than someone who is not taking in caffeine.
Believe me, I lived in Europe, and it's like super
Very common.
common. It's the espresso after dinner.
Espresso after
and
dinner.
I lived in Spain before I lived in France, and like they would have dinner at like 10 or 11 p.m. and like a full strength espresso. And I was like, what the heck? I can't do this. No way.
And so that's from the perspective of our deep sleep. And I would say if you're going to drink caffeine, which I do, I drink coffee. We're having a delicious coffee right now. But I would say try not to have any caffeine after noon. And know that caffeine has about a 6-hour half-life for most people. That does vary a little bit. But that means that 12 hours after you have your coffee, you still have about a quarter of it left in your system. So really trying to utilize that kind of number to say, well, if a cup of coffee has about 80 milligrams of caffeine, that means that you have 20 milligrams of caffeine left in your system, usually when you're going to go to bed, if you have one cup of coffee in the morning. So take that with a little bit of a grain of salt. The other one, it was alcohol. And if we're talking about alcohol, really it's the byproducts of alcohol that tend to inhibit our sleep. And those byproducts are actually some of the biggest suppressants of REM sleep that we have. The other one is actually something that doctors like me prescribe, which are SSRIs. And those medications also tend to inhibit REM sleep.
So selective serotonin reuptake inhibitors, SSRI.
Yes, that's right. Yeah. Thank you for that clarification. Yep. And so those do inhibit REM sleep for people. Now, alcohol, people will say, though, alcohol is it's processed in your body over the course of about an hour. But those byproducts will linger around for somewhere between like 6 to 9 hours for people. Now, that means that really the only good time to drink alcohol is with your morning coffee with a little bit of Kahlua in it, maybe
Sweet. New
Not
Nolan strategy? New Nolan strategy.
Not that I'm recommending that, but what I would say is that if, there's really no way to get good sleep with drinking alcohol. And so that being said, I'm not telling you not to drink alcohol, but what I am telling you is that be a little bit selective in that, and consider that when you do drink alcohol, know that you're not going to get optimal sleep that night. And the next day is not going to be an optimal performance for you regardless. So your sleep will not be fantastic. And also, alcohol has other effects, such as is a diuretic, will cause you to pee out a little bit more. You'll be a little bit dehydrated. You get a little bit of a sympathetic rise in the morning. So your heart rate will be higher following a night of drinking alcohol. And so those are all things to kind of consider when you're looking at whether or not you should have a hard, stressful workout or race the day after indulging in alcohol. I guess the final thing that I would say to people is if you are having trouble with sleep, there's two different things that I kind of take into account for that. One is the people who have trouble falling asleep. Usually that kind of comes from either a mind racing perspective where your brain won't shut off. And the strategies I utilize for that for patients who I talk to tend to be number one, consider trying to do a wind down period with all the good sleep hygiene that we've talked about. But number two, take a bunch of notes right before you go to bed. When you have that to-do list that's in your head, put it down on paper. And even just that act of kind of going through and writing a few things down can help release that anxiety a little bit for people. Having a little bit of a mindfulness practice surrounding this to help kind of wind down can be beneficial. There's two apps that I like, Headspace and Calm, both of which have guided meditations and mindfulness, as well as bedtime stories. So, Eller, you might like those. They essentially have nothing to do with kind of your day-to-day activities and are ways to allow your brain just to kind of creatively wander off and fall asleep easier that way.
Nice.
And then the other category is really people who wake up in the middle of the night. So people who wake up in the middle of the night and they cannot get back to sleep. And what I would usually tell people then is number one, we do not want to associate the bed with sleeplessness. So what I would say is if you're trying to fall asleep for more than 10 minutes, get up and get out of bed. Number two, after you've done that, give yourself a little bit of time doing a non-stimulating activity. Do not look at your phone. Do not watch TV. Don't turn on your iPad. But you could pick up a book. You could do a to-do list. You could write in a journal. And then after you've done that for probably 10 to 15 minutes, go back and go through your nightly routine again. If you normally brush your teeth before you go to bed, I would encourage you to do that. I would encourage you to, if you normally read before you go to bed, do that in your bed. And then give yourself another 10-minute window of trying to fall asleep. The other thing that you can utilize is all of our senses turn off during sleep except for our sense of smell. And so people will use aromatherapy at nighttime. And so you can use things like lavender, or people will drink chamomile tea, or apply something called lemon balm. And your brain can associate that with sleep if you utilize it purposefully during that time. And so you can apply a little bit of lavender to your pillow, and that will help you fall back into a state of sleep. So those are all kind of just some short, quick things that people can do to try and get better sleep.
Man, this is like one of my favorite topics and episodes. It's so awesome talking with you. So thanks so much for taking the time. And well, before we go, I actually do have a little quick disclaimer. This podcast is for general information purposes only. No patient relationship is formed. It's not meant to be a substitute for professional medical advice, diagnosis, or treatment, and listeners should not disregard or delay obtaining medical advice and should seek the assistance of their healthcare professionals for any conditions of concern. So, with that said, thank you, Teddy.
Hillary, it was a blast. Thank you for having me.
Thank you.